pain. Okay. The pain I'm talking about today is not the not heart pain. It's not the pain when your boyfriend leaves you. So that's heart pain. There's a different pain. This is more like a toothache pain, or let's say your boyfriend stabbed you with a knife, or that's pain, of course. And let's say you have backache. You've been working very hard. You have backache. That's chronic pain. Okay. So pain, acute pain and chronic pain is different. Okay. And pain can be of different types. So this is a general brain network of story of pain. Because if I go to very, very detailed, you might be confused. So we talk very, very simple. So when you put your hand into hot water, nobody's going to put their hand there forever. You're going to pull that hand out of the hot water and say, ouch, isn't it? So that PNS here is called the peripheral nervous system. Okay. It consists of the skin. The skin has receptors, and the receptors here are normally the one that they are responsible for pain are receptors that have no clothing, they have no myelin. We call them free nerve endings. Okay. And this pain travels through the peripheral nerve into the spinal cord. Not into your brain yet, into your spinal cord. And it goes straight, directly back through the spinal cord, through another nerve, to your muscle. And that muscle is the one that pulls your hand out from the hot water. So, ouch, you say. So, this is what happens, okay? And these are tracks. So the pathway or the circuit or the network is important. Okay. So remember that pain doesn't come from your brain. It comes from down going up to your brain. So motto is your brain tells your arm to move. But pain is you feel it, cold, hot, pain-like sensation that goes through your skin, through the peripheral nerve, to your spinal cord, goes up to the brainstem, to the brainstem here. Okay? As it goes up, some of them divide, some will go straight on the same side, and some of them go to the opposite side. Okay? So for example, they are in this network here, you will see this is the brain, cut like your bread, your gardenia bread. When you cut the brain, it's cut like this. So this is gray matter. Then you have white matter. And within the brain itself, you have areas of gray matter again. So this famous gray matter here is called a thalamus. So when you have a pain temperature sense, from, let's say you put your right hand into the hot water, the sensation will come into your spinal cord, but it will cross over from right to left, and it will end up in your left hemisphere. Because remember, your right hand is controlled by your left brain. So whatever pain you feel in your right hand, or right leg, right face, whatever, comes from the left will be analyzed by the left brain. So you see these tracks going out. Some are short tracks, some are long tracks. These long tracks is because they come from your arm and leg. The short tracks, for example, this is called the trigeminal nerve. When you have a toothache, here you are, too much ice cream. You have a hole in your tooth, and you have an infection of your tooth. So it travels through this nerve called the trigeminal nerve that enters into your brainstem, cross over onto the other side, goes to your thalamus, and you see this light blue line here. It goes to this area called the postcentral gyrus of the cerebral cortex. So this is how the brain will analyze your pain. And very fast, because if you put your hand in hot water, or you step on a pin within 20 to 18 milliseconds, depending how sharp that pin is, your foot will be running away from the painful pin. So it's called the descending pathway. Descending is going up. You're going climbing out Mount Everest, so you descend Mount Kinabalu or Mount. So all these pathways or these circuits go up like this, going up this way to the brain, okay, and then they end up at the cortex. So they have to go through the brainstem, like I said here, the brainstem, the thalamus, and the cortex. Okay, and there are many transmitters involved: neuroadrenaline, serotonin, endogenous opioids. So these neurotransmitters are very fast neurotransmitters that make you move your hand away in milliseconds away from the fire, from the painful stimuli, etc. And then at the dorsal horn, okay, where is this dorsal horn? So you go back here in the spinal cord, anything that is dorsal is in front here. At the dorsal horn of the white matter, you will have an area which has abundant opiate receptors and peptides. So these connect with the brain, and at the same time, they try to inhibit your pain. Because some people can walk on fire. When you have thaipusam, when you see our Indian friends, they are able to be in a trance and walk on a hot fire, and you're wondering, what's happening? Because what's happening right now is these painful stimuli are going to the brain, going through the thalamus, but the postcentral gyrus of the cerebral cortex and other areas of the brain are able to suppress. They were able to suppress all these neurotransmitters. Some people are good at this. The soldiers are good at this. People who carry the kavadi are good at this. So they're able to withstand pain. Okay, so they have very strong raphe nucleus and local cellulus that's able to inhibit the pain sensation. So they'll be able to walk on fire, on hot ashes. So this is the skin again, going up, okay, brain, crossing over. So the control of pain comes from 1 and 2. These are the two circuits that are very important. So this is mind over matter, we say. So if you're able to control 1 using your mind, you're able to control pain. So this is the classical pathway, just labeled here from 7, motor neuron reflex. This is spinal. The name of the tract is called a spinothalamic tract. And there is inhibitory synapse in the dorsal horn. I told you the raphe nucleus and local cellulus, which is 3 and 2. This is very close. This is close to your brainstem. Okay? And then it goes to the number 2 is the periaqueductal matter, which is also located in the brainstem. So, but finally, it has to go to the cortex. So this subcortical impulses is the one that says, "Ow! Shout! Oh, I got pain!" So without 1, one would will be unable to appreciate pain. So this is very important, because if you do not understand the circuit, because right now this is the peripheral nerve going into the spinal cord, going into the brainstem, and then going to the brain. Remember, the topic is brain network in pain. So right now, I have to talk about what's happening between area 2 and 1 in the next few slides. Okay?
Professor, can I have a question?
Yeah, no problem. Ask away.
Regarding the physical pain and compare with the psychological pain, what I understood, the brain is understanding exactly the same. Can you please explain, because of you explain now everything that goes to the thalamus after the postcentral gyrus, is it the same processing? That's why is the brain not see the differences between psychological and physical pain?
See, is that Alif or Alif? You're always very advanced. This is a slide, figure 1, that I want to explain. Okay, just now I told you that I'm going to talk about what happens between 2 and 1. So voila, this is a diagram, a study done about 4 years ago. Okay, by looking at chronic pain, where they found out in brains, in our brain, my brain, Ali's brain, Shaliza's brain, Shamimi's brain, we have millions of neurons all over, right and left, frontal lobe, parietal lobe, occipital lobe, everywhere, and these are networks, and they have, we call it tracts. The tract is called the corticolimbic tract. So this is the tract that determines how we appreciate pain. So when they did this study for chronic pain, they studied in a certain number of subjects. They found that in certain humans, you have nodes. Nodes are the big major neurons that control pain. Where are they located? They may be located all over between 2 and 1, everywhere, right brain, left brain, anywhere. And what they found out that you have 127 pain nodes, 81 corticolimbic nodes, and this is, for example, one the left brain, and you can see the right brain also has got different. So there is also a dominancy in pain nodes, so in the appreciation of pain. So if you do an MRI in my brain, I may only have maybe 50 pain nodes and only 10 corticolimbic nodes, for example. You take the guy who puts the kavadi onto his body and you do this whole structure connectivity, and you will find out he may have even more than 300 pain nodes, for example, and 100 corticolimbic nodes. That means that he is able to withstand pain more than myself. So these nodes are present in all the different lobes of the brain. So they are able to determine the tracts, which is the corticolimbic tract, because the corticolimbic tract is the tract that makes you tolerate the pain. So in people who cannot tolerate chronic pain, they are constantly taking analgesia, paracetamol, morphine, I don't know what. They may have smaller number of pain nodes and also smaller number of corticolimbic nodes. Okay, Alif, do you understand a little bit about this?
Yes, getting a little bit more.
Yeah, a little bit more. Still confusing, little bit more.
Still a little bit more information, yeah.
Yeah, I think I sent to, if I'm not mistaken, I sent to the group leader this paper. If you want to read, you may get confused because this is a very advanced paper. So people with arts background may have difficulty, but the way I have this explained to you, I have tried to make it simple because they found that, for example, I work 24 hours. I carry DHL boxes that weigh 20 kilos. I have no back pain. But my friend carries 20 kilos every day and he has very, very bad back pain. We do an MRI on my back. My back is the same as his back. But because our brain pain nodes, pain areas, and pain tracts are different, so I can tolerate pain more than my friend who is carrying maybe the same amount of weight as I am. Okay?
Yes. I think, is it possible that you can also train yourself to, like you mentioned before, the military and all these areas?
Yes.
So you maybe, instead of taking all these painkillers, so maybe try to train your brain.
Yes, absolutely. And now people with artificial stimulation, magnetic stimulation, direct or indirect direct current stimulation, ultrasonic stimulation, whatever, stimulation by massage, stimulation by using yoga or whatever, meditation. Even some people say using prayers. You're able to combine. So forget about all these other tables here, very confusing. Just look at B. So you see that the prefrontal cortex, the amygdala, and nucleus accumbens, okay, and of the OFC and the amygdala and the hippocampus, These areas are very important in pain. Some people, when I was a houseman many years ago, 30 years ago, we would have Chinese females, Malay females, and Indian females coming into our labor room. And we found that, the Chinese and the Malay, they could withstand delivery pain more than the Indian. The Indian would be, really, they couldn't tolerate the pain. So now we were saying, is this racial? Is this just psychological? But when they do the MRI, they will find out that in the people who can tolerate pain, delivery pain, they don't even need an epidural. They're like, is the baby out already? No pain at all. They can read a newspaper during delivery, You find that the prefrontal cortex, amygdala, nucleus accumbens, and the hippocampus areas are very big, huge in volume. So that they are big in volume because they can process the pain, and because they can process the pain, they can inhibit the feeling of pain. So these are very important areas which have been discovered about 4 years ago, okay? But they have done other studies for back pain and all that. So they have already decided that the amygdala, the nucleus accumbens, and the prefrontal cortex, which is the frontal lobe. So frontal lobe is where emotions are. You are angry at me, you want to shout at me, you want to scream at me, you want to swear at me. But your prefrontal cortex asks you to calm down, relax. You inhibit the anger emotions caused by the nucleus accumbens. So when you have an accident, you have a stroke, or you have a boxing injury, for example, Muhammad Ali, his prefrontal cortex may be damaged. So the connectivity or the circuit or the network between the prefrontal cortex, the amygdala, and the nucleus accumbens is abnormal. So therefore, those people tend to easily have pain or feel pain. So here they did a study to look at the hippocampus and amygdala, and they found out that certain areas, the hippocampus is bigger in people who can tolerate pain, and people who cannot tolerate pain, the hippocampus, right and left hippocampus are very small in volume. So how do we make people stand pain? So the SEALs, SEAL, the SEAL commandos, the army commandos, they undergo rigorous training. The sergeant major will purposely inflict pain to them so that when they get caught by the enemy or when they're trying to do certain procedures that require them to withstand lots of pain, if you do their MRI, you will see that their amygdala, hippocampus volume is very big. You have a very big amygdala and you have a very big hippocampus as well. So you have trained, and when these commandos or soldiers retire and they don't do that job anymore, and you measure their hippocampus and amygdala, you will find that the volume of the right and left hippocampus and amygdala will shrink, will become small. So pain is also very important with this. And some people say that the Buddhist monks are able to modulate pain, just like those with the Kavadi, because they have very big amygdalas and hippocampus, and they'll be able to modulate pain from these two structures. Not only two structures, but the medial prefrontal cortex as well. So I think that's all for my talk now. I've covered pain, so I covered the brain circuits or brain network in language processing, so I'm open to questions. We have 30 more minutes. You can ask me anything. I hope I can answer your questions.
Prof, Amani here. Okay, so will there be a correlation of, let's say, because those that can handle the pain usually have a bigger volume in volume, the hippocampus, right? Does that
and amygdala as well?
Will it correlate to their their ability to remember things?
Yes, very interesting question. Okay, that will be very good for short-term memory, but not necessarily for long-term memory. So exercise improves memory and concentration. So if you go jogging, you play football, you play rugby, in the elderly, that will improve attention and memory. Okay, and that will also increase the tolerance of the elderly to pain. So if you measure the volumes of their hippocampus, amygdala, nucleus accumbens, and their medial prefrontal cortex, their volume will be big. But it's only temporary. Remember, our Kavadi boy stops his Kavadi. 3 months later, you do his MRI, everything is back to normal volume. It's like bodybuilding. But nobody does Kavadi every day. You understand? But the commandos have to undergo chronic treatment, chronic exercise, so that they are taught to withstand pain. So when they're taught to withstand pain, the commandos who have been trained maybe for 10 years, the rate of the atrophy or the reduction in volume of the amygdala, hippocampus, prefrontal cortex, and also the nucleus accumbens will shrink at a slower rate compared to those who don't do intensity or intensified exercises that are targeted for pain. Does that answer your question, or are you still confused?
Oh, okay, thank you.
Prof, one question, Shubha here. When it comes to exercise and all that, we know our body will release these neurotransmitters like endorphins and all that.
Yeah.
So when you're talking about pain and withstanding pain, so what is the purpose of withstanding a pain? Is it also as a reward system whereby the neurotransmitters are excreted from the brain to give you that feel of the rewarding feel?
Yeah. Yes, you can say that. Some people, some pain has a tolerance. So when you have pain, of course, these are all the things that are released: noradrenaline, serotonin, endogenous opioids, enkephalin, beta endorphins, and dynorphin. So these are the natural neurotransmitters that are also antidepressant, that are also help you to tolerate the pain. So if you can measure the levels of enkephalin, beta endorphins, and dynorphin in commandos, in the guy with the Kavadi, you will see that these levels are sky high. And if you measure my endorphins now, when I'm talking to you, they will be either normal or they will be very low. So yes, they will give you the good feeling, but these are all short acting. They last only for a few minutes.
Right. Okay.
They don't last forever. For that Kavadi guy to be able to not only withstand the needles and walk on hot fire or ashes, this level of enkephalin and beta endorphin must last for many hours.
Right.
So that takes exercise, that takes, I think, tolerance. That takes also involvement of the frontal lobe, because the frontal lobe is very important, especially the medial prefrontal cortex, in trying to maintain all this.
Right.
Prevent the guy from walking half through the hot ashes and he says, ouch, pain, and he jumps out the fire and run away. So that's the prefrontal cortex that is very, very, very responsible for that.
So eventually the function of this is to increase your attention or memory as a subsequent rewarding system?
You can misuse it, yes, you can. Now, because I know you're talking about rewarding system. So rewarding system is another pathway, But remember, the highway in the brain, there are so many white matter tracks. Some of them cross each other, and some of them you use the same tracks to travel from Johor Bahru to Penang for many other things, for attention, for perception, for mathematics, for emotions. You're still using the same track. So there is a sharing of neurotransmitters and tracks.
Right. Thank you so much, Prof.
Okay, go on. Anyone else? I don't think all 42 of you understand what I'm saying today, but you can always ask questions. Even those who think that I'm a Bachelor of Arts, I don't think I can understand. You can ask me. I can try to explain it as simple as possible so that you understand.
Prof, just one more question. This is regarding the notes you gave earlier on the learning. How does this learn, unlearn, and relearn process occurs in the brain?
Whoa, which notes that I gave you? When?
This one, just before this, pain, the earlier one. The earlier session was.
You're talking about the previous lecture.
Yeah, just before this.
You're talking about language lah.
Yeah, language or learning.
Okay.
Part of that. So how does the connection, how does the thing happens when you learn something and then you unlearn it and you are relearning new things? How does that circuit work, or which part of the brain? Which part of the brain connects to that?
Okay, that we did. Because all these lecture notes that I've given to you is just biased to language processing. Learning is a different process. I think you're going to get a talk on learning from Dr. Aini, I'm not mistaken, or is it from Dr. Hafida? Either in trance or something. So the process of learning and unlearning requires, number one, you to learn and unlearn, you need a prefrontal cortex. This fellow right in front here. So people who are victims of road traffic accidents, or even stroke, when the prefrontal cortex is damaged, you are unable to learn and relearn. So if you have everything which is normal, so you need the frontal lobe. The frontal lobe is emotion, the motivation to learn and unlearn. You need that motivation. If that motivation is not there, the prefrontal cortex doesn't respond. You'll not be able to have the motivation to learn and unlearn. Okay. You need the hippocampus and the amygdala. The hippocampus amygdala is in the middle part of the temporal lobe, on the left side more than the right side. You are supposed to, forget or dull whatever that you have learned before, because memory is a strong thing. So to get rid of memory is not so simple. So it takes a long process. So it's like lots of short-term memory and long-term memory. You have to suppress your long-term memory. If you cannot suppress your long-term memory, you're not able to learn new stuff through your short-term memory. So you're not able to unlearn and relearn. So the relearning process is your short-term memory. You have hippocampus, amygdala, and your temporal lobe complex. And then you need the combination of both your parietal lobe, because your parietal lobe is very spatial. So when you learn something, you may be trying to learn it in space. For example, if you're using your visual goggles or you're using your laptop to learn or unlearn, your occipital lobe is involved, right at the back there, and your parietal lobe, which is very important for spatial. So when you're looking at a laptop, learning in class and learning through a laptop have got different parietal lobe interventions that will tell you what's happening. So to summarize, frontal lobe, very important. Prefrontal lobe, very important. Left-sided amygdala, hippocampus, very important. Okay, and then occipital lobe, very important, and parietal lobe, very important. That means to say the whole brain is needed for relearning and unlearning.
All right, Prof. Thank you. Why does amygdala? What does amygdala do here?
Well, amygdala is fear. You know, when people ask you, there's also an exam question on write short notes on amygdala. So in the amygdala is famous for fear. If I destroy your amygdala, you will see a cobra in front of you and you will smile and kiss the cobra because you have lost your fear. So when you are learning and unlearning, remember, in the process of learning and unlearning, when you go to school, isn't there a process of you are afraid that you may fail to unlearn?
Yes.
Yeah.
Yes.
So that is the input from the amygdala as well. but not as strong as looking at a snake or looking at a tiger. But the amygdala, there is parts of the amygdala that are also circuits involved in learning and unlearning.
All right. So
And many other parts of the brain. In fact, the learning and unlearning is the whole brain. It's not so simplified like this diagram. It's much, much more complex.
right. Thank you, Prof. So the amygdala is like giving a little stress for you to learn.
You need the amygdala. If you have no amygdala, you cannot learn and unlearn properly.
Right.
You will not be able to unlearn and you're not able to learn because you need stress, you say, to learn something.
Yes. Yes, Prof. Thank you.
The fear of failing, comes from the amygdala. Yes.
Yes. Thank you. Thank you, Prof.
Okay, anything else?
Prof, I wonder amygdala is very important to stress out for learning, but if it's not balancing too much, is that also the create less learning process because you stress out a lot, isn't it?
Yes, that's right. That's why the balancing of the whole brain, I'm not talking just only the amygdala together with, remember you have brain structures, you have neurotransmitters.
Yeah.
So all of these have to work together.
Exactly.
And that depends on the brain, because my brain to learn and unlearn may be different from your brain to learn and unlearn due to the cortical structure, the cortical density, the volume. So if I have the right amount of neurons, it will be easier for me to learn and unlearn. You may have problems trying to learn and unlearn certain things because you don't have the right number of neurons. Therefore, some people use, they put the cap on their head, they do their transcranial direct sudden stimulation while they're trying to unlearn or relearn because it helps them, the cortical stimulation.
Yeah. Is it also connected with the habits that we try to create new habits?
Yes.
Yeah, so it's everything with the get rid of the bad ones and try to create a new, it's like actually the same processing.
Yes, and that's mainly frontal lobe.
Yes.
So habits are all frontal lobe, more than parietal lobe, temporal lobe, or occipital lobe. So if your frontal lobe is damaged, you may develop certain annoying habits, okay? Or if you want to do rehabilitation, it will be very difficult for you to get rid. For example, obsessive compulsive disorder, OCD, that is also a bad habit. So that is frontal lobe. So what the neurosurgeons do is they put electrodes into this nucleus in the frontal lobe to try to, when the patient cannot be treated with drugs and psychotherapy and whatnot, to reverse the bad habit, which is the obsessive compulsive disorder.
Thank you.
Okay. Any questions?
Prof, I'm Salini here. I have a question.
Yeah.
For psychiatric patients, right, who like to hurt themselves, actually have pain tolerance or they are addicted to the feeling of the pain.
Yeah, that's right. Yeah, so right now we go back to pain. There's no me. So where's okay? So when we see this network, okay. So remember, the pain nodes and the cortical limbic nodes. So some people they are addicted to pain, so they have to stimulate. They have to cause pain to themselves to be able to keep these cortical limbic nodes active. So, person like me sitting here doing nothing, I have, like, for example, I have 127 pain nodes and 81 cortical limbic nodes. I do not need any stimulation because, I'm not a person who needs to be stimulated because I'm not a sadist or whatever. But if I want to tolerate pain, so you see the commandos, what they do when they want to tolerate pain, they beat themselves up. They take this little thing and beat themselves at the back. And the more they beat, the more pain they have. And then they try to stand or tolerate the pain. So that act of doing that will increase the number of corticolimbic nodes, okay? And then increase the number of corticolimbic nodes will make them able to tolerate the pain that's inflicted to them. And then when they stop doing it, then this number of nodes will drop, maybe from hundreds or whatever to maybe less than 80, and then they will be very sensitive to pain. Even a single pinprick will make them jump. So that's the whole process, the whole connectivity to the corticolimbic pathways, which is, of course, through the medial frontal cortex, amygdala, nucleus accumbens. Very important track here. If you want to do military neuroscience and you want to choose the best soldier for the Malaysian army, you look at their tracks and see whether you can increase these tracks. You can increase the track, you can have a soldier that can withstand pain. Good for war.
Prof, can pain be addicted?
Yes, definitely. I think we saw this, yes. We saw the encapsulates. You cannot be addicted to noradrenaline. You cannot be addicted to serotonin. They're all short-acting. But you can be addicted to endogenous opioids. Endogenous means from within the body. So when your body, your brain has used so much enkephalin, beta endorphins, and dynorphin to withstand the pain, and you still feel the pain, then what people do is, we doctors give them exogenous opioids. So exogenous is from outside, exo, outside, endo, inside. So, but we don't have drugs that are called enkephalin, beta endorphin. We give them morphine, we give them cannabis, we give them ketone, we give them whatever, and these are the compounds that make them get addicted because the endogenous supply in the brain is not enough for them to withstand the pain.
Okay, Prof. Thank you.
So someone is asking why they want to get ketone. Well, ketone is cheap, fast acting, doesn't kill the guy. Why not advising you to take that? Huh? Okay. Any other questions?
Yes, Prof. This is Hong here. I have one. I'm just curious whether if the brain has any pain receptors.
Okay, very good question. When I first reported for duty as a neurosurgical resident in Belgium, I had a few, I was the only colored guy, yellow guy, and the rest were all white guys. So they were joking with me, say, "Oh, you want to be a neurosurgeon because you want to eat the monkey?" I said, "What? In the monkey?" So they showed me a picture that came from Hong Kong when the monkey was seated, under the round table, and everybody with chopsticks were digging into the monkey's brain and eating the monkey for dinner. The monkey was alive. So I said, no. I said, that's Hong Kong. I'm Malaysian. I said, I don't eat monkey's brain, whatever. But the story is that the pain fibers are only found on your skin, the skin of your head, your bone, your periosteum has got pain fibers. And this around the brain, there is a skin called the dura. And the dura is fed by the cranial nerve, for example, this trigeminal nerve. So when we neurosurgeons are doing awake craniotomy, removing the brain tumor does not give pain to the patient. It's only when I want to open the skin, bone, and cut the dura is when the patient feels the pain. So when I'm actually operating within the brain itself, the patient feels no pain. You understand? Because remember, you have to have, like this diagram, okay, pain comes from the skin or the muscles, and they have these receptors, and then they go to the peripheral nerve, into the spinal cord, and from the spinal cord, it goes into the brain, up into the brain. So that's why operating the brain, you don't have pain. That's
Alright,
why it's
so
not
in
called
other
a brain ache. It's called a headache. A headache, not a brain ache. Because the brain has no pain.
Yeah, so the brain is unable to feel pain, in other words.
Yes.
Okay, alright, thank you.
So, Prof, does that mean the monkey didn't feel any pain when like people were eating its brain?
No, it didn't. Of course, it's cruel. I don't think people do that anymore. But I'm talking about 50 years ago. So, my white Belgian friends, they, aha, you want to go back to Malaysia and not open the monkey's brain? I said, no. So the monkey does not feel pain. But that doesn't give you a reason to eat monkey brain, huh? Or even any animals.
Prof,
Yes.
I got one client. She has been raped by someone lah. So after the scene, after the case,
Yeah.
she always put her hand on her kemaluan kan.
Yeah, okay.
So when I asked her, she will say to me that she put her hand because she feel the pain until now. So I'm not sure that one is regarding the pain or she is more to trauma.
It could be both, because as you know, even at the genitalia area, you have
Yes, genital area.
yeah, you have the skin, and the skin in the genital area, if you look at the brain, it is very close. It's here. Your clitoris, your penis, your vulva, your uterus, the pain is here. Right in the middle.
Right in the middle, okay.
And women. Men penis is here. Women vagina, clitoris is all in the middle. So here you are, just imagine right in the middle. This all the structures in the middle here are very sensitive structures because they go straight down into the brain stem. So that's why if you have any problem in the middle here, you tend to have more sensitivity towards pain and all that. And then when you have the problem with your genitalia and all that, maybe you say rape and whatever not, this is very close to your frontal lobe. This area here, where your genitalia is very close to your frontal lobe, your premotor cortex. So very close. If I can show it, yeah, okay. So this is your okay. This is your prefrontal cortex, okay. So your genitalia and your penis and your vulva and your uterus is somewhere there, very close to the prefrontal cortex. So that's why the influence of the prefrontal cortex onto abnormal feelings that are associated, like you said, with rape and all that stuff, makes it very sensitive. And this is because of the anatomy. Do you understand?
Prof, so the way still same like just now Prof explained.
Say that again. Repeat your question. Can you repeat your question?
So for this case, the pathway, the client may have the pain and also trauma.
Yes.
And the pathway of the pain is explained by the Prof just now. Is that right?
Yes, and you can, I think, prove it with MRI tractography. and you can see what kind of the tracks. You may need to show, images and all that to her first,
Okay.
which can be very traumatic. But that's very scientific, of course. Not many Malaysian psychologists or psychiatrists do this. You find them mainly in North America or Europe. They will do imaging to confirm that it is from the brain. Okay, it's now 8:53. Legally, I have 7 more minutes with you. Any more questions?
Prof, can I ask something that's not related to today's lecture?
Okay, what is it? Everybody's listening to you, 42. So long it's not top secret lah. Okay, go on.
No. So when I was studying for my undergrad, we did sheep brain dissection.
Yep.
And once we removed the dura, the brain quickly turned black. So I'm wondering, for neurosurgery, how come that doesn't happen when you perform neurosurgery?
I think your sheep brain, the brain was taken out of the sheep. The sheep is dead, kan? Yeah, so in neurosurgery, the human is still alive. The blood supply is flowing into the human brain. So as long as there is blood flowing into the brain will look pinkish, whitish. It will never turn black.
Okay.
Okay, even the brain doesn't ever become black. Even your pure white Caucasian, when you have a stroke, the brain will not become black. The brain will become pale white, and then it will undergo coagulation necrosis. It's like putting your cheese outside in the hot temperature, and it will just like ice cream. It will melt like ice cream.
Oh.
That is how the brain dies.
Okay, thank you, Prof.
Yeah. Okay. Any more questions? Another 5 more minutes. If there are no questions, we can stop.
Prof, just a curious question. Since you mentioned about ice cream, do we know the temperature within our brain or within the skull and the brain?
Okay. If you go to the restaurant, they take your temperature from your forehead. So when you go to the restaurant, your temperature is 36.5. Your brain temperature is 37.5. Your brain is hot-headed. Your brain is 1 degree higher than your skin temperature. Do you understand?
Oh, okay. Is there any reason that the brain is 1 degree higher?
Because number one, your skin is more visual. Your brain is enclosed by skull, bone, blood vessels, very close to the heart. It's just about 1 feet away from the heart. So the brain is very warm. And there's no way for the heat to disseminate out of the skull. So that's why the brain is 1 degree higher than your skin temperature. So if you're 36.5, it is 37.5. That's why male brain does not tolerate heat. Male brain likes it to be less than 37.5. Female brains like it to be hot. They like it to be more than 37.5. In fact, female brains study better at a higher temperature compared than male brains. Male brains may require air conditioning or whatever, I don't know, but female brains they do better when the temperature is higher than their brains. And the brain can only survive until the temperature of 41 degrees Celsius. At the temperature of 41 degrees Celsius, which is 40 degrees of the skin temperature, your brain will start melting like an ice cream. That's why when your baby has a fever, you should not allow the fever to go higher than 38 degrees Celsius, because then your brain cells is being fried by the fever.
Oh dear. Professor, it's very interesting what you're saying that in Sweden,
Yes.
interestingly, when our kids have a fever, when we go to the doctor, and doctor usually tell us that don't give any fever medication if it's not 38.5. So it's actually brain is already 39.5.
Yes.
So it's interesting that I'm hearing that is they are, I don't know if they minimize the painkilling giving or other things, but is now I'm really scared.
No, when you have fever, you have both pain. Pain is the least of your concern during fever. When you fever, the most important thing, our human organs cannot work at a temperature of 38.5 degrees and more. When you hit 41 degrees, your brain shuts down. It starts melting. Your neurons get destroyed. So that's why any temperature of 38 has to be managed.
Okay.
Because the increment of your temperature is 0.5 degrees Celsius per minute. That's why you have to quickly take, cold water or whatever, or some people use it, tap it, sponging, try to cool off, use a fan, try to drop the temperature down. Because if the temperature is too high, the